All right, so ankle mobility is huge when it comes to knee issues, hip issues, even back issues. So let me explain. So ankle dorsiflexion, which is this movement. So if you see it from the side, it's that movement. That is the movement that we go through when we take a step. We've got dorsiflexion, that's what happens, okay? So here's where it matters. If you don't have dorsiflexion, which is super common because of ankle sprains, just habits of overusing our calves, there's lots of reasons why it happens, but we get stiff ankles in general. And so what'll happen is, if we don't have this, the common compensation is to advance over the foot by turning the foot out. So we walk toed out. How many people do you see turned out, right? Well, the issue with that is, if you're turned out this way and as you advance over the leg, what happens is the knee falls down and in. Well, that loads, if you can see this, if we do this, you can see it on the medial meniscus, lateral meniscus, and there's compartments at the knee. So when we move over it like this, you're loading it symmetrically. As soon as we do this, the foot tends to be out of the midline, and then that pulls us in like that. Same thing that happens when we squat. So if we don't have this, what happens is we turn the foot out and it causes us to shift our weight backwards. So a lack of ankle motion will affect you when you walk, but it'll also affect you when you squat and your ability to use your hips. When it falls in, you load the compartments asymmetrically, puts more stress on the ligaments, puts more stress on the compartments in the knee, and that can lead to knee pain. It also can lead to hip pain up the chain, the lack of motion. When you squat, if you can't use your hips and your legs effectively because the ankle's stiff, that adds to stress in the lower back, and that's where people injure their backs. So ankle motion is absolutely critical at having good mobility for knee, hip, and a healthy back.